honor to welcome and introduce our next eminent speaker, Professor Tanuja Nesari, who has been icon for all the students like me who took interest in research of medicinal plants. I feel lucky to be in contact with her and be blessed with guidance of Madam since I started my work in South Africa. She is MD and PhD in Ayurveda. She is director of All India Institute of Ayurveda, CEO of National Medicinal Plants Board, and chair for Health Sector Subskill Council under Ministry of Ayush, Government of India. We have visited and personally witnessed the vast yet outstanding work AIIA has been doing under her brilliant leadership. She is a familiar Ayurveda professor with 30 years of experience in teaching and research. She is an acclaimed international speaker on Ayurveda and has demonstrated exemplary commitment of working in Ayush systems, taking the legacy of Ayurveda to the highest levels. Her influential leadership has brought numerous credits to the discipline of Ayurveda. Dr. Nesri has contributed immensely as an academician, researcher, medical practitioner, and administrator throughout her life. Professionals trained under her are serving across the country in various capacities. She has also published 115 papers and authored 16 books in English and regional languages. Her most recent honor includes the Harihar Mukherjee Memorial Award for remarkable contribution in the field of ethnopharmacology in 2019. We are so honored to have you, ma'am. Over to you, and we are keen to listen to you and get enlightened with your expertise and knowledge. Thank you.
So thank you. And at the outset, I congratulate Dr. Sharduli Terwarkar and all the organizers of Ubuntu for organizing this international conference for all the South African and Indian subcontinent. And it's a very, very important topic as Ayurveda, and it's not it is our traditional wisdom, classical, but providing this experiential basis to evidence what is the research in Ayurveda for sleep disorder. And I'm here to do the justice to the as it is desired what the Ayurveda has done, what are the evidences are created for this basic need of one's life, that is a nidra. Ayurveda sleep is called as nidra, as my previous speaker also mentioned. And if we know everyone that slogan for today, this year's 2021 World Sleep Day, which we had recently organized, was regular sleep is a healthy future, because on sleep everything depends, even economy also depends, the future development, everything, one's career, one's health, one's happiness depends on the sleep, and that's the economy also says. The statistics on sleep disorder today, if we say that there are more and more more the drugs are, the more investment is increasing day by day for inducing good sleep. And as we know that as per even CDC, Centers for Disease Control and Prevention, not getting enough sleep is linked with many chronic diseases and conditions such as even type 2 diseases, heart disease, obesity, and depression. And that threatens our nation's health, because single one person and collective wisdom, collective consciousness. So thousands and millions, if the sleep disorder, if it is 61% of the global adults believe that their memory is worse when they have not slept well. And if that we also understand, and it is said that effect of sleep deprivation, it is not only irritability, cognitive impairment, but the metabolic disorders, and everything depends on the sleep. And let us understand what Ayurveda says, that these are the three main pillars of the health: Trayopastambha, Nidra, Ahara, and celibacy, one's daily routine, Brahmacharya. But the one important pillar, like diet, sleep is very, very important. And the same concept in Ayurveda is said that when mind gets exhausted and it really needs sleep, that rest, to the resting mind, and all the anabolic processes are happened, synthesize hormone during the sleeping time. And that's why sound sleep, when I think someone gets sound sleep, he is the best most blessed and fortunate person in this world. And same exactly Ayurveda says that Nidrayattam Sukham Dukkham Ayustasya Hitaitam. So what is the why sleep is so important? Not only because it gets rest to the mind and the body, but the pleasure, health, Sukham Dukkham. If the one gets good sleep, it's a pleasure. Doesn't get, it's a misery. And the person leads a miserable life without sleep. And the nourishment, strength, vitality, vigor, knowledge, memory, everything depends on the sleep. And that's why it is one such area in the brain where severely affected by sleep deprivation. Then the modern science also says that LC is the principal area of adrenergic secretion in the brain, and hence it's very, very important for all cognitive functions, memory, response, and emotional reactions. And before examination, everyone, one day prior to examination, everyone wants to have a good sleep. But that's the time before one day we really have to have not everything just sleeping 2 3 hours that really impairs your recall, and that's why you should have a very good sleep. And problem in sleep considered as a cause of many diseases and habitual awakening in the night, habitual sleeping during the day, poor sleep, all these are the types. And these are some of the types: Ratri Bhava, Tamo Bhava, Shleshma Sambhava, Manasrambhava. So these are the various types, but it is also indicative of bad prognosis and complication of other diseases. And the entire world has experienced during this long COVID time and post COVID time that the data suggests that more than 70% of the people who had COVID are facing disturbed sleep because of excessive vata, time to fall asleep, and reduced kapha, time to fall asleep. So we really have to do many vata, down regulating vata shamana conditions and disorders. And coming to the researchers, what Ayurveda can offer, because it is a more vata, more rajasa, ratrau jagaranam ruksham snigdham swapna praswapanam diva. So all vata down regulating, vata pacifying measures are to be done. Tamas indicating, adding measures are to be done. And as it is ahara, that is a diet related, lifestyle related, mental relaxation related. So ahara, vihara, and vichar and achar, all these are aspects to be done as a management. But this study using polysomnographic assessment of the sleep is done along with the description of few herbal single drug therapy with scientific background, because Ayurveda, what are traditional wisdom, we try to find out the scientific aspect mechanism behind why it is said that nothing but is a scientific, providing the scientific wisdom to our age old wisdom, scientific aspects. So it is subject awaken for 60 to 101 subjects which were kept awake for 60 to 114 hours. Change is found. They were disturbed equilibrium, neuromuscular fatigue, difficulty in concentration, threshold for pain load, and cortical nerve undergoes chromatolysis. And this is what these are the studies done by the Kamlesh Gulia and et al. And the Ayurvedic understanding on the Snehana Shirobasti really reverse these changes. And is insomnia, sleeplessness the only problem as anidra, tama, and anikapha? So we have to really, these changes were measured, like oil massage, bathing at night, eye packs, oil on the both the eyes. Then there are many other, like curd rice, proper regulation, sleep hygiene, and soothing and relaxing, and food substance like adding rice, wheat, pastries. Some simple like for the chicken soup and other. And what is the principle is you should have light, unctuous, vata down regulating diet, which is not too spicy, not too dry, like caffeine, alcohol, that immediately is a stimulating, it is soothing, but at the end it really deprives one from the sleep disorder. And the milk is really good. It is said that Nityam Kshira Ghrutaabhyaso Vayasthapananam system. So the buffalo milk with ghee is a really very good soothing and sleep inducing. And in classical says that there are various herbs like Solanum xanthocarbum, Adathoda vasica, Solagum nigrum, Borevia diffusa, and Solanum melongena, that is Varta kimul. These are, and during in the diet, it is not only curd, but mansa rasa, madira, and shastik shalik rice are also good. And the herbs which are really studied well are Jatamansi, Nordostoctis jatamansi, Brahmi, Becopamoni, or Tagir, Vacha, Valeriana, Vacha, Shankapushpi, Kahakajanga, and Ashwagandha. Name itself says that Vithania somnifera, which indicates good sleep. And if you look at the various researches, the valerian has found beneficial effect on sleep architecture, meaning it increases deep sleep, which is necessary for growth hormone production and body repair, and the melatonin secretion. So effect on the melatonin secretion, the valerian has a very good effect to secrete and synthesize melatonin. That's also the research is randomized clinical study is also done with the Tagaradikvatham. The same is with Ania somnifera, where ashwagandha along with pippali have been evaluated experimentally as well as clinically in somnifera, and various researches with sleep-induced insomnia and anxiety. Ashwagandha, and especially in this post-COVID time, long COVID, and All India Institute also, we are also working with ashwagandha in our post-COVID management, where the sleep induction and the time of induction and all vata-related aggravated symptoms we have seen, it's very important. Along with these herbs, it is not only single, because Ayurveda is a holistic and it is a package of practices. So along with herbs, we need to have panchakarma, snehana procedure, because vata should be down regulated, raja should be reduced, and tamas should be balanced. So that's the principle. So shirodhara and tablet that those also been studied along with shirodhara, Gandha, Sarpagandha, Jatamansi, Parsi, Kevani, and Tagar. So all these combination, it the tablet name is Insomrit, and that also been studied. There are few classical herbs. Because of the time constraint, I have given the abstract, the how many the classical herbs showing sedative, relaxing, tranquilizing effect is a vacha, Acorus calamus, Priyangu, Calacarpa, Saptaparna, Kuttaja, Puga, Nimba, Brahmi, Sallaki, Punag, Ashwagandha. So, and Glycyrrhiza glabra, all methylrasayanas, and you can see lot of evidences are there, and few herbs proven to have sedative effect on central nervous system, that is a calming effect. So these are all from Ayurvedic classical texts, Nigantu, Pharmacopoeia. So it is not only herb, but it is our lifestyle and early diet before, like during after sunset. Only 1 hour after sunset, you should have your meal, dinner, early dinner, and it should not be too heavy, not too light, but it should be unctuous, soothing, warm, and sedative. And most important thing, what we have practiced, I would like to appeal that your all screening time, like mobile, WhatsApp, chatting, and all electronic gadgets, if we keep away from our bedroom and from the bed, and 1 hour you should have a relaxation meditation. What we have observed and done the research in our yoga therapy, because we have the holistic tertiary care hospital at All India Institute of Ayurveda. So what we induce is the nadi shodhana pranayam, meditation, prayer, yoga nidra. Morning is a shirodhara for all those patients, along with these herbs and good diet and relaxation at night with the prayer. This holistic package of practice really induces good sound sleep, which is very, very important for the holistic health, that gives not only health but positive health but also happiness. Thank you, one and all, for patient listening. Namaste and pranam to my mentor, Sri P.H. Kulkarni, and all the friends who have joined in this August gathering and conference. My best wishes. Thank you. Namaste.
Thank you so much, ma'am. Um, it's wonderful always to see your presentation. Here I have the same question that I asked to Honorable Dr. Shrikant sir, that if there is any project you have in mind for Africa Study Center, please suggest us and please guide regarding that. Over to you, ma'am.
Yeah, main thing is we really we can develop the practices which are very user friendly and which are accepted to the culture ecosystem and the practices in the Africa. So we can definitely take up conduct the some study research studies and conduct, so we can help the local by using the local food, the local herbs. We can develop the practice package of practices, and with All India Institute of Ayurveda, which is under Ministry of Ayush, we are ready to initiate collaborative research project, as well as being a tertiary care as well as postgraduate teaching institution. Will be very happy to All India Institute of Ayurveda to initiate some training program along with Africa Study Center.
Thank you so much, ma'am. I have another question before other questions arrive here. What would be the oil recommended by you for African continents, as there are actually, according to geographical region, there are different oil seeds we find there, and from olive oil, sunflower oil, all these oils are available there. So what would be the recommended oil for massage and also for intake for better sleep management according to Ayurveda?
Yeah, because the oil weights, the principle, the oil itself is against ruksha guna, that is a vata alleviating. But sunflower oil, according to Ayurveda, it is a vida hitikshna, it induces more raja. So what I would strongly recommend is a olive oil, which is has a similar properties like sesame oil or a coconut oil, and anything which is a cooling, having a pack on the body, which is a coconut predominant, the similar type of oil, which may be olive has the similar combination of the fatty acids mono and poly. So I think olive can be the best option.
Thank you so much, ma'am. Thanks a lot. It's always wonderful to get guidance from you. I hope that your guidance will be always there with us in future journey as well. Thank you so much. Thanks for your time.
It's my pleasure, and thank you and congratulations for organizing this conference. My all best wishes. Thank you.
Thank you, ma'am. Thanks a lot.